Hello, good evening. So, welcome to yet another session of Ask Me Anything. So, these sessions we have every Tuesday at 9 p.m. IST on my YouTube channel. Okay, and normally what I do is I talk on a session for about 5-10 minutes and then it's open to questions. People ask questions. Okay, different kinds of questions, and I try to answer them. Okay, so today is yet another topic. Last week we discussed about the classification of diseases, and we saw diseases have been classified as curable and incurable. So like last week what I said, today we will be seeing how can you say that a disease is curable, in what all criteria have to be fulfilled. Okay, so we'll go through that today. So identifying curable diseases, how can you say that such a disease is curable? So last, we'll just start recap at what we had last week. So it's called roga in Sanskrit, and it's the most used synonym. There are other synonyms also. So but today what we are going to see is the classification. Okay, classification is, it is Aushadha Sadhya and Shastra Sadhya. Sadhya diseases have been classified as diseases have been classified as curable, that's sadhya, and asadhya as incurable. So how do we say that a disease is curable? That's what we are going to see. And Ashtanga Hridaya in the first chapter itself has mentioned a few pointers basically for us to find out, if these things are fulfilled, then we can consider the disease to be curable. Okay, he has not mentioned the name of any disease which are curable, but any disease, if these things are seen, then we can say that the disease is curable. Okay, we'll see that. Okay, Ashtanga Hridaya, first chapter 11 to 12th. This is the way the shloka goes. Okay, Sarvaushadha Kshame Dehe Yunah Pumso Jitatmana Amarmago Alpa Hetu Agrarupa Rupo Anupadrava Atulya Dushya Deshartu Prakriti Pada Sampati. Okay, Griheshu Anuguneshu Ekadosha Margo Nava Sukha. Sukha means easily. Okay, so the disease which have got all these things, then we can make out that these diseases can be easily cured. Now, in the next slide, I'll show you what we, how the meanings of all these things. Sarva Aushadha Kshame Dehe. Sarva Aushadha Kshame Dehe. In the sense, Kshama means the body has got the strength. Body has got the strength to undergo treatment. Suppose you're undergoing panchakarma, you're going through any probably a surgery or something. If the body has got strength, then it is curable. Okay, Sarva Aushadha Kshame Dehe. Yuna means young. Pumsa means a strong person. Okay, Jitatmana, somebody who is not too anxious. That means emotionally he is strong. Jitatmana. Okay, Amarmago. If the issue which he is serving, he's going through is not, the marma has not been affected. If the marma is affected, then it becomes very difficult to cure. If the marma is not affected, it is easily curable. Amarmago, alpa hetu. The causative factors. Say, for example, you caught a cold. Okay, if you caught a cold by, getting exposed to cold wind, okay, that's fine. You got exposed to cold wind, then you got drenched in the rain, and then you ate an ice cream. So the causative factors have multiplied, the wind, the rain, and the ice cream. Then it is not so easy to handle. If it's only one, if that means the causative factor also is minimum. Alpa hetu. Okay, then alpa, so alpa agra rupa, that means the premonitory symptoms. It's the symptoms which come before the disease also minimum, then it's also easy. Then alpa rupa, and if the symptoms, if in a textbook they says these are all the symptoms of cough. If you've got all the symptoms, then it becomes very difficult. If you've got only a few, then it is easy to manage. Okay, then what? Then anupadrava. That means it doesn't have complications. Like, say, for example, if you've got diabetes, and with diabetes you have got neuropathy, you have got retinopathy, you have got diabetic ulcers, lot of other complications, then the diabetes itself is difficult, so if your disease doesn't have complications, then it is easy. Okay. Then this is very interesting. Okay. Atulya Dushya. The doshas are three: Vata, Pitta, Kapha. Doshas are 10. Okay, the seven dhatus: Rasa, Rakta, Mamsa, Meda, Asthi, Majja, Shukra, and the three malas. That means the three wastes. The fecal matter, your urine, and the sweat. So doshas are also attached to all these things. So for a Vata, so if you look at the dhatu, Asthi, bone. Vata is in bone. So if the Vata disorder is in the bone, then it becomes difficult. If the Vata disorder is in the muscle or in the fat, somewhere else, then they are not one plus one, right? It's easier to manage. If the Pitta problem is in the blood, you find it very difficult. Okay, so if the inflammation is more in the blood, then it is difficult. If the inflammation is in the joint or in the muscle, it is easier. So Pitta in blood is difficult. Okay, like as Vata in Asthi is difficult. Kapha in the fat is difficult. Okay, Kapha in the muscle is difficult. So Atulya Dushya. Again, Atulya Desha. This is also interesting. Atulya Desha is for a Vata person, Jangala Desha, or dry place where Vata is high. So if you have got a Vata disease and you are living in a Vata region, then the disease is not easy. If you're a Vata person in a Kapha land, it's easy. Okay. Atulya Rutu, even season wise. If you have got a problem which is because of cold things, and the weather is also, and the climate is also cold, the season is a cold season, or the other way around, you have got Pitta issues and it's very hot in the summer, then it becomes a problem. So it should not be Atulya Desha, it should not be Atulya Rutu. Okay. Then it should not be Tulya Rutu. Sorry. Then what? Atulya Prakriti. If the Prakriti of the person and the disease, if it's a Vata disease in a Vata Prakriti person, then it becomes tough. Okay. Then what? Pada Sampati. Pada Sampati. There are four. I don't know whether I've gone. Yes, I've gone through this also. There are four pillars of treatment. One is the doctor. The second is the medicine. The third is the patient, and the fourth is the person who helps the patient. We in India we call it the bystander, or somebody who supports the patient's health. These four things are there, and they've got all the good qualities. Then the disease is easily curable. Okay. Then griheshu anuguneshu. Everything is fine, and if your stars are all aligned, you say, oh, my lucky stars. You call that. If all the graha are the stars, if all the stars are aligned so that you are healthy, then your disease gets cured faster. Ekadosha. If you have got, okay, it's a Vata disorder, predominantly Vata, that is easy. If you've got Vata and Pitta at the same time, then it becomes very difficult. If you've got Vata, Pitta and Kapha at the same time, then we call that asadhya. Okay. Eka Marga, any disease, they have got Antaf Marga, Bahir Marga, and Madhyama Marga. Okay, directions in which the doshas can go. If it is only in one direction, the doshas, the problem is only in one direction, then it is easily manageable. Then Nava. The onset is not old, it is not very, very chronic, just started, then it becomes easy to handle. Okay, so if all these things are there, all these things, if either of these things have been satisfied, then the disease is easy to handle. Okay, you can start asking your questions. Let me start. Namaste. We get to learn a lot about Ayurveda from attending your sessions. Thank you very much. Yes, it's my pleasure too. Okay, it's all His grace. We have learned a lot of things. See, as a family, we have been into Ayurveda for generations. So a lot of things which I have been taught is not something which I created. And my grandfather always, he used to do the same thing. He used to sit and talk and discuss with people and spread the, knowledge. So it's the same thing what we do. We don't have any patency that it's universal knowledge. So it gives me great pleasure in, in having these sessions every Tuesday. Okay. Yes, and thank you for attending it also. Gary, you discussed paneer in your last sessions. Is it best to avoid it? If not, how often to use it best? Sorry. So if you look at paneer, paneer is how is paneer created? Paneer is created by uh, spoiling the milk. The sense you squeeze lemon into it, or once the milk is spoiled, it breaks. You know, and then you remove the water, and what remains is basically paneer. So paneer is created by spoiling the milk. It's spoiled milk by and large. Okay, so and it is not something which is easy to digest. There's a reason why we say paneer should not be consumed on a regular basis. So it all depends upon how much your digestive capacity is. As you age, I would say cut down on too much of paneer. Go for foods which are easily digestible. Paneer, cheese, too much of non-veg. One piece here and there is fine. No, if you're used, but too much of things which can cause indigestion have to be avoided. So paneer also comes under that category. So once in a while, might be once a week, a few pieces. It's fine, Gary. Okay. Yeah, good evening. Good evening. Krishna, how to naturally build Agni for a person who has got mild constipation? Is it curable? You know, mild constipation is something which is not easy for me to understand. Okay, because for a person who has got Vata Prakriti, there is always a tendency for him to get constipated. So it is natural for him. Okay, his koshta is ruksha, and whenever he passes motions, also it's always broken, and dry. So constipation is not something which is uncommon for a Vata person. And so, but if you are Samatha Prakriti and you are conscious, that means you are not passing motions regularly. Okay, that means that has to be handled. If you're a Vata Prakriti person and you're not passing motions regularly, then powders might not be a good choice. Then I would say anything lubricating would be a better choice. Ghee is fine. You can start with castor oil, then mix castor oil with ghee. Okay, 50 or 50 or 75 castor oil or 25 ghee. Then slowly make it 50-50. Then you keep on reducing the amount of castor oil you take, keep on increasing the ghee. Over a period of time, you'll notice that just with ghee, you'll start passing motions. Okay, so Agni is something which can be built for a person who's constipated. You try to see that he passes motions regularly. Agni automatically builds if you don't overfeed the Agni. Okay, you don't do overeating, or you keep on eating in multiple times, or you're somebody who does too much of exercise. Okay, or you don't do exercise. So if you do things moderately, or if you take shower immediately after your food, all those things will impair the Agni. So lifestyle things also have to be taken care of. Okay, normally for a Pitta person or a Kapha person, constipation doesn't come. Constipation happens only when the Vata goes up, and that Vata, as I said, is because of the dryness. It has to be managed by lubrication and not just by drinking too much of water. How to contribute to it? You have Namaste. Just the thought itself is good. Okay, I'm thankful. Okay. Yes, Vachana. Okay. I'm interested in books. Which translation should I refer for Ashtanga Hridayam, Sri Kumar or Sri Kantamurti? Ashtanga Hridayam is actually in about six sthanas, different. You have got Sutra Sthana, Sharira Sthana, Nidana Sthana, Chikitsa Sthana, Kalpa Siddhi Sthana, Kalpa Sthana, and Uttara Sthana. Lot of, so it's a huge six sthanas. Out of that, the first sthana is Sutra Sthana. Sutra Sthana is the only one that has been translated by Sri Kumar. Okay, and he's done a fantastic job. If you are only looking to start, Sutra Sthana, you can get Sri Kumar. Sri Kantamurti has actually translated the whole book. Okay, But translation wise, I'm not supposed to say this, but I would prefer you to go through Sri Kumar. Start with Sri Kumar, the Sutasthana. The first two, his Sutasthana is totally 30 chapters. He's come out with two books, 15 chapters in one book and 15 chapters in another book. It's an amazing translation. You can start with that. But if you want the whole book, then I would say Sri Kantamurti is actually a good choice. Hi Aditya. IBS, IBD, leaky gut treatable. Worldwide 1.3 billion people affected by these. If can be treated by Ayurvedic patients, can get benefit, and a successful business model can be built around the treatment. I understand, Aditya. Okay, let me put it this way. If you look at the symptoms and what happens with IBS, it is almost compared to a disease called Grahani in Ayurveda. Okay, Grahani means Grahana. You would have heard the word Grahana. Surya Grahana, Chandra Grahana. That means holding. Okay, when the moon holds the sun, the sense, that means it is covering the sun. So Grahana is basically holding, and there's a disease called Grahani Roga where the body is not able to hold. Grahanam is not happening. Hold food. That means you eat food during the process of digestion. The food is not being held properly in the system and it goes out. Okay, that is basically irritable bowel syndrome. And if you look at the symptoms compared to what Grahani has been told, yes, you see that in Grahani also. So, and when Ashtanga Hridaya mentions about diseases which are difficult to cure. Okay, Aditya, for you. Okay. Vata Vyadi Ashmini Kushta Meho Udara Bhagandaran. Okay. What? Arsham se Grahani Tyashtav. Okay. So Grahani, Ashtav means 8. 8 diseases have been told which are difficult to cure. Out of that, Grahani also has been mentioned. That means Grahani Roga or IBS is not something which is very easy to manage, because it's not only about the food, it's about the food, it's about his lifestyle, and it's also about his vichara. Vichara is very important in IBS or in Grahani Roga. If you're stressed or anxious and all those things, it's not very easy to cure. Yes, people who have realized that and they have taken care of the health really well, we have got fantastic results about Grahani. Okay, it can be really, I don't say it can be completely cured. I don't want to claim that, but there are cases where we have treated it and we have got no issues for maybe 6, 7, 8, 10 years. But sometimes when they go overboard, they feel they're going to get it, but it is well under control. Yeah, Aditya, it's a good question, Aditya. I'm noticing whatever I eat is affecting my mind. So does it mean Manoroga is disease of body? See, let us not think that those are two different things. When you have got a problem with the body, your mind gets affected, and you've got a problem with your mind, your body gets affected. Both are interrelated. So when you eat something, if it is whatever you eat, then that has to be taken care of and you have to undergo treatments for that. But otherwise, some people, when they eat certain foods or they drink certain drinks, they feel that the mind behaves differently. Then those things can be avoided. But whatever you eat, if it's affecting your mind, then I personally feel that you have to get consulted and you have to see that you get that fixed. Okay, so Manoroga is not disease of the body, but Manoroga and Sharira Roga are extremely interconnected. Okay. I have very low tolerance of cold. Please suggest any. Okay, Rams, then let me make a wild guess. You are somebody who might be on the thinner side. Okay, thin or lean. You might be more a Vata person, because Vata people cannot manage too much. Even slightly starts becoming cool, they want to cover their body up. They can't handle cold. If you are that kind of a Prakriti, then I think that's your nature. I would say cover yourself up, okay, and see that you take foods and drinks that will warm your body. Otherwise, if you are normally built, or you're slightly on the plumper side, and then you feel cold when exposed to cold seasons, then I say it's high time that you fix your Agni right, because the metabolism is the one which holds or keeps the body warm. That means you're missing your Agni in your system, your metabolism. Okay, then that has to be taken care of, and that has to be increased. For that, probably you should be consulting an Ayurvedic doctor. If you're Vata Prakriti person, you're feeling cold, it is your Prakriti, it is quite natural. Okay. What is the treatment for gallstone in Ayurveda? Yeah, Hanumesh Rao. Yeah, gallstone is something. Let me put it very clearly. Gallstone is not something which is easy to handle. Ashmari has been mentioned in Ayurveda, which is not easy to handle because of one major reason. Even allopathic people find it very. Otherwise, I say the moment you see a stone, they say remove your galls. Because liver is so protective about itself that it is very, very, very difficult for most medicines or any medicine to penetrate into the liver, and gall is sitting inside the liver. Okay, the gall, you mean the gallbladder. So very, very difficult for medicines to actually penetrate into the gallbladder and break the stone or flush it out. There are medicines, we do give medicines. If the stones are small, we see that they are definitely flushed and removed. But if it becomes really large, then it becomes tough. So if your stone is small, okay, if you get small stones, multiple stones also, no problem. Okay, that is something which we do treatment, and we see that those can be removed. Yeah, so your Prakriti is Vata Pitta, but I don't remember what your question was. Krishna was then. Okay, to naturally bring your Agni back, right? So you should be having good Agni, if I'm right. If you are probably due to activities like too much exercise, or not sleeping early, or too much of spicy food, or a lot of stress and all those things, your Vata might be going up. There's a reason why you're getting constipated. Okay, so that has to be taken care of. Once your constipation is little and your Vata is brought under control, then your Pitta will automatically take over. Now Pitta is being probably overshadowed by Vata or the Kapha. Okay. Ayurveda says ghee is good, but that doesn't mean you don't consume ghee, you won't. Ayurveda says ghee is good, but does that mean if you don't consume ghee, you won't be healthy? No, there is no hard and fast rules about anything here. Okay, Vachana, I would say ghee is really good, and ghee, not only Ayurveda, even now, right now, if you look at even modern science, says that ghee is supposed to be one of the best fats. Okay, but that doesn't mean that if you don't take ghee, you will become unhealthy. Okay, like if you look at India, culturally we are used to milk and ghee and all those things, so our health revolves around milk and milk products and ghee and all those things. But if we go probably to the western countries, they are not used to taking ghee. They're still healthy, right? So they have got their own way of taking fat. Okay, so fat has to get into the system in some form or the other. And we being animals, the best, pardon me if let me tell you this thing. Animal fat, in the form of ghee or butter, where we don't have to how do I put it, ghee. So fat in animal fat probably will actually build your system better. Okay, that's what Ayurveda says, and that's what we also have noticed. So can't we replace it by coconut oil or some other oil? Yes, you can do. But when you ask me about superiority, we still consider, Gadam Tailam Vasa Majja. Okay, of all there are ghee, oil, fat, and marrow. These four things can lubricate. Of that, consider ghee to be superior. Okay, but that doesn't mean that if you don't take ghee, you will not become healthy. That's a different thing altogether. Dushi Visha and Gara Visha, what exactly is the difference? Can you explain contemporary example? Okay. Dushi Visha, let me put it this. Dushi Visha is slow poisoning. Okay. In the sense, over a period of time, you have been consuming, probably, you have got a tap made of lead. I mean, lead. Okay. And you are drinking water from that tap for long periods. So slowly you get poisoned over a period, might be 2 years, 3 years, 5 years, 10 years. Okay, so that is the way you normally get dushi visha. And what happens is it stays in the body because in slow doses it gets into every cell of the body. Garavisha is also called Kaivisham in Malayalam, okay, where people mix something in your food and give you, or probably it can be, you eat something in the hotel and that was not very clean. It had a lot of things which could not be processed by the body. And that, so one is long term and one is short term for you to understand it easily. Okay. uh, Flax seeds, in my opinion, it is not something which cools the system. It is slightly warming, so people prefer eating flax. People make laddus also of flax seeds. People prefer eating that during the colder seasons to keep the body warm. So sometimes you say when those laddus are there, flax seed laddus are there, our elders say don't eat more than one or two per day because that might generate too much heat. Okay, for when in places where it's very cold, probably you can eat more, but in places like Kerala where it is not so cold, it's just cool, probably one laddu per day would be fine. Flax is something which will keep the body warm. What is the diet you have to follow for gallstone? See, gallstone can happen due to a lot of major two things. It can happen. One can be the bile salts have solidified. It can be a bile stone. Another thing can be a cholesterol stone. Okay, two things. So it is important for you to understand what, if you can scan or something, it's important for you to understand what kind of stone you have got. So your diet can probably uh, you know change according to that, but I would still say you should not be on a very high fat diet, and especially deep fry food you can't be. Apart from that, you should be somebody who should be physically active. You can't be sedentary. Alcohol is a big no-no. Okay, smoking is not good. And apart from that, what non-veg, some fishes are not good, especially sea and shell fishes might not be good. Apart from that, not too much of restrictions. Eat in moderation, eat on time, and be physically active. Okay. How much ghee should one consume in a day? See, this it's different from person to person. If you are able to digest, I would say anywhere close to about 2 to 3 tablespoons per day is fine. Okay, but if you're not able to digest really well, then I would say you should be taking only 1 tablespoon. For some persons, we see that they're not able to digest, so we tell them to take 1 teaspoon on empty stomach first thing in the morning, and again 1 teaspoon at bedtime. Okay, so it depends. You can give in divided doses also. Otherwise, sometimes when they're undergoing treatment, then the dosage actually varies. We start with 30 ml, and on the seventh day, it can go up to 200 to 250, sometimes 300 ml of ghee also, depending upon the person's digestive capacity. So, if you on a regular basis, I would say might be a minimum 1 tablespoon would be decent enough. You can mix it with your food and have. Okay, and probably if you want, you can have 1 teaspoon of ghee at bedtime and then drink, and drink a little bit of hot water on top of it and go to bed. But you should be able to assess yourself whether you're digesting it or not. So if you have 1 tablespoon of ghee at bedtime and you get up in the morning, and when you're drinking a little bit of hot water, in the burp, if you feel the taste or if you feel slightly heavy, that means you are not digesting it. Okay, then your digestion also should be taken care of. So the dose, mainly what I'm trying to tell you is the dose depends upon the your digestive capacity. A person certain dosha has the tendency to consume foods that his prakriti should generally avoid. Okay, let me put it this way. See, I'm not very clear about your question. Okay, okay. So if you look at a person, if he's got a certain dosha, if he's got a certain deficit in a dosha, then the body naturally asks for something to put that thing back into balance. Let me give you a very good example. That's the reason why, as children, my grandfather and all of us used to insist children to eat on their own, mix food on their own, because if you look at a family, joint family, you've got 20 people, definitely all 20 people might be different prakritis. And so for 20 different prakritis, you have to cook 20 different dishes, which is practically impossible. Okay, so what happens here is when you're sitting to eat food, okay, normally you see some people add a little bit of salt when they want to, some people add a little bit of pickles, some people want, they want a little bit of sambar more into that, they mix their food to their tastes, but when you're feeding somebody pre-mixed food, what happens when you get from the market? Pre-mixed food has the same taste for everybody. It does not satisfy your pancha mahabhuta or your tridoshas. So in your liking, that's why kids also, if they know how to mix their food, all people mix their, even if you give the same kind of dishes, you notice that you taste 20 people taste their food, they taste different because the way they mix it. That making that taste is, and mixing that food is to satisfy their doshas and their imbalances. Okay, so hereafter, when you mix your food for your kid, you taste it, it is tasty, and you feed the kid. You are feeding the kid to your taste. Okay, see that the kid mixes the food and eats for the kid's health. I hope I've answered your question, Prasad. Apart from ghee, which other healthy fat can we take on a daily basis? How much quantity of good fat should one take? I think I've already answered that question. It again depends upon from ghee is something which probably throughout India people take. Okay, and I said, it all depends upon the amount of you can digest. And second thing, depending upon your area or what you're used to. In Kerala, I would say you can take coconut oil. In Tamil Nadu, they take sesame oil. Somewhere they take mustard oil. Some people take cottonseed. Some people take, groundnut oil. So it depends upon what you are genetically used to. And second thing is that Acharya says very clearly that the food which you eat should not be ruksha. That means should not be dry. It should be, you should mix ghee or, it can't be dry food basically. So you should, what I tell my patients when they come to me is, you should consume good amount of fat. Okay, and then you should actually, so when you take that kind of fat, it gets into each and every cell, and then you should do that kind of exercise to burn that fat and see that it comes out of your body. That is the only way your body can get lubricated. If you just take fat, because the doctor says, okay, you can take 3 tablespoons, you start taking 3 tablespoons and you become sedentary, the fat gets deposited in the koshta, around the koshta. Okay, once you start moving from the koshta, it will start getting into the shakas and it will make the whole body strong. So it's not only about consuming a good amount of fat, it's also doing exercises to burn it. Note that is very, very important. Okay. Best time to exercise, before meal or after meal? I would always say the best time to exercise is before meal. But what happens is, if you go after meal, you know that the moment you put food inside your stomach, all the blood supply and everything, the concentration of the whole body is to basically digest the food. The moment you start exercising after that, your leg is moving, your hands are moving, that needs a lot of support. So the blood supply, which is supposed to be concentrated completely on your tummy, okay, gets diverted, and that is one reason for indigestion. So Acharya says very clearly that you should not exercise after your food. Do it before your food. Does Ayurveda say anything about blood donation? Should it be done regularly? Ayurveda does not say about blood donation, because blood donation or blood transfusion was not there, not been written in the Ayurveda texts. But still, when there is blood loss, people have been asked to drink blood, okay, especially goat blood. And they were also, even traditionally, people also give, transfusion used to happen through the anal opening. That means through rectum they used to give enema, blood enema. So there, the blood group and all those things doesn't matter. We're not giving human blood. Blood group and other things don't matter because it's not directly getting into the bloodstream. So liver is something, people take the blood of the goat, or they eat the liver, or they also give, as I said, they also give blood as enema. Okay, transfusion has intravenous transfusion has not been mentioned in Ayurveda. There is one reason for it. I don't see, for emergency you can do that, but otherwise, when you start getting it directly into your blood, when you look at these sapta dhatus, rasa, rakta, mamsa, meda, asti, we are skipping the rasa dhatu. Once you skip the rasa dhatu, the essence of the rasa dhatu is what which actually goes into each and every dhatu. When the rasa dhatu is deprived of certain things, okay, because you're directly giving it either into the muscle or into the blood, the proper rasayana of all the dhatus, when we think logically from Ayurvedic perspective, the direct thing to all the dhatus are not happening. But in emergency, yes, I say, you can give, see, when you notice what even modern medicine people do, when the hemoglobin is extremely low, what they do is they ask you to do a blood transfusion and increase the hemoglobin. Okay, after what they do is they give you oral things, so that it gets into the rasa dhatu, then rasa, rakta, mamsa gets into each and every dhatu. So emergency is fine, but otherwise it's always good for it to go oral. So it's good for you to take a teaspoon of cow ghee mixed with warm water early morning, empty stomach. Yes, it is good for you to take a tablespoon of cow ghee. I would say, yeah, don't mix with warm water. If you can take it and drink a little bit of hot water on top of it, then it will help it digest faster. Or you can also mix it with about a little bit of maybe half a glass of hot milk, and drink it. Okay. And if you're able to digest it, absolutely no problem. For Vata body type, what type of exercise is good? Cardio or heavy lifting? Heavy lifting is not prescribed for a Vata person. For Vata, he should do mild exercises. Okay. And cardio is actually good. And he can't overdo, because he's definitely got a frail body. That doesn't mean he's not strong. He's strong in his prakriti. Okay, so don't try to lift too much of weight or overdo your exercise, because Acharya says, no, ardha shaktya nisheva, so use only half your strength to do exercise. For Vata person, his strength is less, so use only half his strength. Don't over push. How much gap should be there between dinner and having milk at the bedtime? We normally have upma, pesartu, etc. for dinner. See, give at least maybe 1.5 hours to 2 hours before you go to bed. Okay, and when you're going, so after your dinner, give at least 2 hours for. Don't have your dinner immediately go to bed. So, and I don't want you to wait for 4-5 hours so that everything is gone. No. So wait for about 1.5, 2 hours. Then what happens is food is almost digested. Okay. It is not completely digested and gone and it leaves the system at all. No. It is almost digested. And then at that time, when you drink a little bit of milk and sleep, that milk which is in your tummy, along with a little bit of food which is still getting digested, that will make you feel slightly heavy and see that you will sleep throughout the night peacefully. But if you had your dinner early and you take about 4-5 hours before you go to bed, that means you're having a dinner at 6 o'clock or 7 o'clock and you're going to bed at 12 o'clock. By about 8 o'clock, 9 o'clock, your food is completely digested and gone. By about 10 o'clock, 10:30, you're awake, so your metabolism kicks back. You feel like eating something, drinking something, but because you've decided not to eat or drink, you go to bed, okay, hoping that the metabolism which has come up, will digest the fat. That is wishful thinking. That agni can digest anything. It'll suck all the nutrition from your body. It is not good. So give a gap of 2 hours and drink milk and go to bed. Don't over drink milk. Okay, little bit of milk is enough. Some gunas are promoting to eat raw. Some gurus are promoting to eat raw food more so that sleep quota will come down. Uh, see, as I said, every activity in life, according to Ayurveda, revolves around your Agni. If you are able to digest that kind of raw food, I don't want to say no. Okay. But only thing is you should be careful about how clean or how hygienic it is, because most people get sick because of they eating raw food, not because the food is raw. Okay. How much ever you clean it, you'll have spores and things, and especially leaves, lettuce and all those things. If it's not cleaned properly, you'll have worms and eggs of worms and all those things inside it. So, but Ayurveda generally says, if you cook something, it becomes lighter. Say if you take a salad, for example, the cooked salad is lighter than the uncooked version. So because cooking happens here also in the tummy, so once cooked is easily cookable. So it's your choice, I would say. You can't say that you have to eat only raw food or you have to eat only cooked food. It's again a choice. Cooked food is absolutely fine, and Ayurveda promotes more of cooked food rather than uncooked foods. I see you wearing earrings. Any Ayurvedic significance? Yes, I used to wear earrings in my both ears. I still have a whole ear, but due to some reason, this broke. So I decided to retain one. Okay, I'm on the lookout for the next one. Let me see if I can get another one and then put it in both ears. And Karnavedhanam, if you look at, that's what we call it in Ayurveda. It comes under the Shodasha Samskaras. Like from birth, cutting the umbilicus, doing the Jata Karma, doing Annaprasha, doing Upanayana, Samat. In that, one thing is Karna Vedana is also important. They say, if you hold the ears properly, you'll see a place where there are no blood vessels. You can check with small kids who are born. You'll see you prick there. There's no bleeding at all. Okay, and Karna Vedana is basically done to remove all bad doshas, and it also, they say, it also opens up your other sense. So for people who want to go ahead in education, I recommend people, as kids, I recommend people to do Karna Vedana irrespective of boy or a girl. I've read it's best, Gary. Yeah, I've read it's best not to eat chana dal, but it is fine to eat kala chana. Your thoughts? Some Gary, let me put it this: we can't brand something really bad or brand something really good. Okay, it depends from person to person. Okay, if you have got skin issues, chana is not supposed to be consumed. But on a regular basis, kalaya is, it's called kalaya. Kalaya is not, when you look at the good pulses and the bad pulses. The best pulse according to Ashtanga Hridaya is mung, and the worst is urad or black gram. Okay, so kalaya comes somewhere in between, but it is not as good as mung, and it's not as bad as what do you call urad. It's slightly better than urad, but it's something which needs a lot of caution. So if you take that in small quantities, it's fine. Okay, but there are no hard and fast rules about this is bad or good. You can take chana dal, or you can take also kala chana, but be moderate about it. But if you've got some skin issues, I think it's better you consult somebody before you take it. Taking 30% of millets in diet is useful. I don't want to comment on that, because let me be very clear, I don't consume millets, or might be very, very little. I'm born in the state of Kerala, where we are used to eating rice, and I take rice every day. Okay, and people who are up, see, the reason is that rice grows in places where I've got abundance of water. In Kerala, we do have rains and abundance of water. Rice grows, so people eat rice here. Okay, in places which are dry, okay, they don't, where you can't have water, and the grains which grow there don't need water. That's why millets grow. They are called trinadhanya in Ayurveda. Okay, so most people who are there, they consume millets. Okay, that doesn't mean that millets are superior and rice is bad. I'm not talking about the nutrition part. You might say iron and the zinc and that magnesium and that. That's all to a different topic. I'm telling you, for vata pitta kapha and to maintaining a health, whatever you're used to. If you're used to rice, rice gives you really good energy. If you're used to millets, millets will give you good energy. Okay, there are certain millets which come up in certain seasons. Consume that in those seasons. Don't mix a lot of millets. People do that. They mix all millets and all grains. They call it multi-grain and confuse the body. Take one grain per meal. Okay, that's what I say. Don't mix because gunas are different, of different. Rice is different, wheat is different. So if you start mixing everything, looking at that has got calcium, this has got iron, this has got that, this is, let me mix everything so I'll get everything. No, once it goes inside, you don't know how it reacts. The gunas are different. Stick to one grain. Okay, and if and I would say predominantly consume um, grains which you are genetically used and which grows around you. Okay, Hanumesh Rao, what is your favorite breakfast excluding Nendra? Wow. Why should I exclude Nendra? Nendra is the big Kerala banana which I consume. I consume half of the banana every day, but that is also cooked. Okay, I don't eat it raw. Cooked banana I consume. Okay, every day. Apart from that, almost many days. Okay, I consume khichdi or pongal. One thing. Okay, second thing is puttu. I eat. I don't know what you can call that in any other language. It's called puttu, and I consume idiyappam. Okay, some certain days I also consume upma, but the nendram, half nendram param is constant every day. Okay, so okay, let me put it this way. By and large, I don't consume fermented foods like idli or dosa. So sometimes when I go for a function, okay, see, I'm invited for a wedding. I go for breakfast. I say idli there. I don't say I will not eat idli. That idli I will eat. I will eat two idlis. It's not that I don't like the taste. I eat it because I don't eat it because it's not healthy. Okay, to be consumed on a regular basis. So I eat the two idlis. No complaint. So these functions happen might be once in a month or might be once in 3 weeks. So eating the two idlis or three idlis once in 3 weeks, in my opinion, is okay. So let me put it. By and large, my breakfast is something which is non-fermented. Okay, freshly made breakfast. Okay, nowadays there are a lot of hype about AI Ayurveda. AI models are being used as Ayurveda doctors. What are your views about it? Can really become effective? There are a lot of places where AI can chip in. We can't say no, we can't say yes. Doctors, even surgeries, if you look, surgeries are being done by AI robots right now. So, and if you look at radiologists, the scan report, the moment you scan, the computer's got millions and millions of scans. So, no, it knows by and large what is normal, what is abnormal. Okay, so everything is becoming AI right now. So why can't AI penetrate into Ayurveda? AI can actually penetrate into Ayurveda also. I don't say no, but I would say sometimes you know the factor of yukti. Here, what happens is, because with symptoms or something, we cannot treat somebody until we have to look into a lot of factors. Okay, the Ashtasthana Pariksha, 8 places where we look at a patient. Okay, Ashtasthana Pariksha, where we look at the patient, that's for the patient, and Dashavidha Pariksha, where we look at the disease. Okay, so Ashtasthana Pariksha is Nadi, Mutram, Malam, Jihva, Drik, Sparsha, Shabda, Akriti. 8 things. And 10, okay, Dusham, Desham, Balam, Kalam, Analam, Prakritim, Vaya, Sattvam, Satmyam, Tatha, Aharam. So all these 10 things which we look. So this is some, and then you come into conclusion, and then if all these things can be looked into decently by a computer, then I feel, yeah, computer can do basically a great job. I would say computer can do a job which probably it might not make big mistakes if everything is fed into a computer. Okay, probably excelling something, you might need the human mind there. So I personally feel that AI can get into a lot of things. That's the way the world is going, right? Difference properties of sugarcane jaggery versus palm jaggery. Okay, sugarcane jaggery is basically something which increases kapha beyond a certain limit. Beyond a certain limit. So, in issues where you have got more of kapha, jaggery has been barred. Skin issues, jaggery cannot be taken. If you are probably doing a karma for panchakarma where you're making the person vomit, we give jaggery water for him to vomit, help the person vomit. So what you call sugarcane jaggery is something which will increase kapha. Now, interesting thing is that jaggery is something which has to be Purana Guda, we call that old jaggery. That means 1 year old Guda becomes better or becomes pathya when compared to fresh Guda. But palm jaggery, if you look at medicinal properties, yes, some people do use palm jaggery, but wherever you see jaggery in Ayurveda, it is only sugarcane jaggery. But palm jaggery, I would say it is not as cold creating as it is not as kapha increasing as sugarcane jaggery. Okay, medicinally, if in most of the Ayurvedic medicines, we don't use palm jaggery at all. Does pepper on fruit balance dosha, etc.? Pepper on fruit will actually, it's called prakshepa. You only prakshepa is sprinkling on top. Okay, so when you prakshepa dravya, when you put pepper on top of fruit, it will not change the property of fruit. Okay, most of the fruit cool the system down. So when you sprinkle a little bit of pepper on top of it, it makes the fruit, probably it will help the fruit digest faster. Okay, that does not mean that the property of the fruit will change. Okay, property of the fruit, once it gets digested, it can still cool your system down, but the digestion of the fruit will happen better because you have sprinkled the pepper on top of it. The property of the fruit cannot be changed. The kids are given kora, which is a millet in my neighborhood. I believe it was fed it to. Is this a more recent habit in Kerala? Kids are given kora, I know that, but in our kids, in the sense babies, okay, in our neighborhood, we actually give kannangaya, or banana, which is unripe banana, which is a very small one, okay, green in color, that is cut into small pieces, dried, powdered, and that is basically heated. That powder is heated and given as food for babies, till they grow beyond a certain limit. After that, after Annaprashana, in my area, and after Annaprashana, we give rice only to the kid. Okay. See, for a change, as I said, if that thing grows in your neighborhood, I would say that is okay. But if you're bringing it from some other place, just because of health, you're giving it, I don't know how good that is. Okay. But if that is a tradition, that giving kora to kids, I think, I'm not interfering. I think you should carry on doing it. Okay. So we are coming to an end of today's session. We have answered most of all the questions. So next week we are not there because it is New Year week. Okay, weekend. So probably you can celebrate a New Year, and we will see on when is that? I think it has gonna be on the 6th of June. Okay. So I'll answer this question, the last one. What to do for sinus problem in early morning? I would say sinus problem early morning could be, you are either allergic to the cold things, or it might be also because of your food or your lifestyle. Okay, that also has to be taken care of. What you eat, what time to go to bed, what kind of water you take shower in, how much of oil you apply on your head. Lot of factors. What oil you apply on a lot of factors decide how your sinus functions. Okay, so I can tell you, you can do salt water gargling, you can do steam inhalation. All those things are fine to basically clear your sinus out. But if you have to really manage and treat it, then we have to look into a lot of factors. For that, I think you can go to any doctor close by. Good doctor will definitely handle sinus. Sinus is not very easy to, not very difficult to manage. Okay. So see you next week. Till that, see you next year. Happy New Year. Merry Christmas and Happy New Year. Okay. Let 2026 be yours. Okay. Let us all be blessed with a lot of health and prosperity. Namaste and good night.